Hey everyone, and welcome. If you're gearing up for NEET PG, then you know those image-based questions on surgical instruments can be a real game changer. So today, we're going to do a high-yield power review of the absolute must-know instruments, so you can walk into that exam and just ace it. Let's get right into it. All right, take a look at this. This is a classic exam question. Do you know what this instrument is? And maybe more importantly, can you name a procedure where you'd use it? If you're drawing a blank, don't even worry about it. By the end of this, you'll have this stuff locked in. So here's the plan. We're going to walk through a surgery, step by step, from the very first cut all the way to the end. And along the way, we'll introduce the key instruments you need to know for each stage. This is all about building a mental map, making these tools way easier to remember when you're under pressure. Every single open surgery, no matter how simple or complex, starts with one thing: the incision. And for that, you need the most fundamental tool in the entire OR, the scalpel. But as you can see, not all blades are created equal, right? They come in all these different shapes and sizes, and each one has a very specific job. You've got the number 11 blade, which is super pointed and perfect for stab incisions. And then you have something like the number 22, with that big curved edge for making long, sweeping cuts. The key is simple. The shape is always designed for the job. And that brings us to a super common exam question that tests exactly this. They'll give you a clinical scenario. A patient has an abscess that needs an incision and drainage procedure. The question is simple. Which blade are you reaching for? And the answer is number 11. You have to connect the procedure, incision and drainage, with this sharp, pointy blade. Here's a really easy way to remember it. For I&D, you need to make 2 straight cuts, kind of like the number 11. I&D, blade number 11. Got it? Okay, so the incision is made, we're in. Now you've got to handle different tissues, and sometimes they're incredibly delicate. You can't just crush them, and that's where forceps come into play. This brings us to a really important concept, being atraumatic, which just means not causing damage. And this right here is Babcock's forceps. Look at the tips. See how they have those little openings? That's called being fenestrated. It lets the surgeon gently grab onto delicate tube-like things, like the appendix or the bowel, without squashing them. So if you see an exam question about holding the bowel, you should immediately be thinking Babcock's. Right, we're inside the body cavity, but it's crowded in there. To actually do anything, you need a clear view of what you're working on, and that is the critical job of retractors. They literally just hold organs and tissues out of the way to open up the surgical field. Now, examiners absolutely love to see if you can tell the difference between similar-looking instruments. And a classic pair they use for this are 2 retractors, the Morris and the Deaver. At a quick glance, they might look kind of similar, but they're used for totally different things. So on the left, we've got a Morris retractor. But now look to the right. Hey, that's a Doyen's retractor. That's the instrument from our very first question. And remember its special job? It's made specifically for pelvic surgery, like a C-section, where it's used to gently hold the bladder out of the way. The big takeaway is that every retractor's unique shape is tailor-made for a specific part of the body. Let's move on to how surgeons control bleeding. Modern surgery uses these amazing energy devices to both cut tissue and stop bleeding at the same time, and you absolutely need to understand the basics of how they work. This diagram shows how monopolar diathermy works. Now, this is a hot topic for exams because things can go wrong. Just look at the circuit. Electricity flows from the machine, down through the surgeon's tool, through the patient's body, and then it gets collected by that big sticky pad, the earth plate, before it goes back to the machine. So, what do you need to know for your exam? Safety. To prevent the patient from getting burned, 2 things are absolutely critical. First, that earth plate has to be stuck on perfectly, with wide, complete contact on the skin. And second, the patient can't be touching any other metal, like the metal parts of the operating table, because that could give the electricity a dangerous shortcut. All right, you've seen the basics. Now let's put that knowledge to the test with a little quick-fire round. This is just like what you'll face in the exam hall. You ready? Let's do it. First one up. Identify this device and tell me its purpose. This is the Varus needle, and its job is to create what's called a pneumoperitoneum. That's just a fancy way of saying it. It safely inflates the abdomen with CO2 gas to make space for laparoscopic surgery. Okay, next one. Is this a secure reef knot or an insecure granny knot? This is a secure reef knot, and here's how you can tell. See how the ends on each side come out opposite each other? That makes the knot lie flat and tight. A granny knot would have both ends coming out on the same side, and that's no good. And the final question, This patient is in the Trendelenburg position. What surgery is often done in the reverse of this position? The answer is thyroid surgery. By putting a patient in reverse Trendelenburg, you help reduce blood flow to the neck and give the surgeon much better access. Fantastic job on that round. You see, you're getting the hang of this. Clearly, knowing your instruments is a huge piece of the puzzle. But let's just zoom out for a second and see how this all fits into the bigger picture. We are living in the age of robotic surgery now, with incredible systems like the Da Vinci you see here. But even with all this mind-blowing technology, the basic principles, cutting, grasping, retracting, controlling bleeding, they are exactly the same. Mastering these fundamentals is the foundation that all of this advanced surgery is built on. So we'll end on this thought. We've talked about scalpels and forceps and even robots, but the single most critical instrument in any operating room, the one that makes everything else work, well, it isn't made of steel. It's the surgeon's knowledge, skill, and judgment. And that is exactly what you're building right now. Keep up the great work. You've got this.